In today's class, we will study case series. What is meant by case series? Case series is nothing but a similar type of patients came to your hospitals that you are reporting is nothing but case series. Consider you are a doctor practicing in a specific area. In that area, in a particular period, the similar type of patients, same cases are coming to your hospital, same signs, symptoms. That is unusual, not a natural. That is unusual. New symptoms patients to your came to your hospitals, and those symptoms are something new. That unusual cases are there. The series, like in the series, in the systematic series, the patients are coming in the sequence. Those patients, how you, based on the symptoms, how you diagnosed, what are the investigations you did, and what are the management, how you treated that patients, what is the outcome, within how many days the patients are the symptoms subsides or the patients live well. All these things are reporting or making a case report in a, the more than, suppose if you are consider 8 patient or 10 patients, if you are documented all those 8 patients, the detailed descriptive things you are reported, that is nothing but the case series. The first thing is that the definition is, a case series is a descriptive study. It means that describing some things. The descriptive study design that involves group of patients. You see here, it is not a single patients, the group of patients with similar diagnosis or the similar treatment outcome, that is documented and analyzed to highlight important feature. This is nothing but the case series. Next is the, what are the characteristics should be there in the case series. The main thing, it involves multiple number of cases. Multiple means the small number only, 5 patients, 10 patients involves in that the case series, and no comparison. Here there is a no comparison. You know, while we are doing any research, the comparison like placebo one group or standard one group and your drug one group, like that, here there is a no comparison control group. Describe clinical presentation. In these things, you are describing some things, how the patients complaining, what is the history, that is describing presentation. In that case series, you can write the management, how you manage that those patients, the how many days patient within that the outcome result will come, that also you can mention all these things. And next characteristic is often retrospective. Retrospective is nothing but writing past history, that is writing the previous thing happened. The often the mostly the retrospective things report you are writing, but can be prospective, but rarely, if you want, for the suggesting for the futures researcher, the prospective, that is also there. Now the, what is the purpose of this case series? Writing the case series is, one is identify knee disease and syndrome. Whenever as a doctor or as a researcher, if you identify something new in your hospital or clinic, identify new disease, for the reporting or explaining to others, this is the helpful, this is the main purpose. Next, describe rare and unusual clinical features. Suddenly unusual or rare symptoms, patients or cases came to your hospital, that is reporting purpose. Next one, document outcome of novel treatment. The, in that patients, new drugs, novel drug is nothing but new drug you tried, in that how result is came, that is for the documentation outcomes, you can write a case series. Next is the generate hypothesis for future study. It means that you are suggested, suppose if you are writing a case series, you written that in the history, the almost all the patients, 5-10 patients are the, because they are suffering from the particular water in the area, the water, borewell water or the river water, due to that river water, the patients are suffered from the similar disease. You are the generated hypothesis. In that, just only you are mentioned that this may be the cause, but you are not concluding the cause and effect. this helpful for the hypothesis, future research purpose, generate future studies. The in the next research, the researcher may take the whether the that river is the cause for the specific symptoms, like that. This is the, while you're writing the case series, that it will generate the hypothesis for future studies. The next one is the example. Here, very good example, that is psoriasis patients. Reporting outcome of 10 patients treated with new Ayurvedic herbal formulation. You new herbal formulations you prepared. You are that one of the surprising result came within a few days. Only the patients, all the symptoms are cleared. The patients is now in good condition. The all the series in the series form you are written. This reporting is the comes under the case series. Okay, not a single patient, more than 8 10 patients, the few patients, if you are reporting outcomes of 10 patients treated with new Ayurvedic herbal formulation for the psoriasis. This is like a case series. Next, the advantages. What are the advantages of this case series? The first is easy and inexpensive to conduct. While you are writing the case series, it is very easy because only few patients, if you are taken, and there is a no cost, that is inexpensive. Only few amount will required for writing pages and some things, that is inexpensive. Next is the useful for early recognition of new conditions. This is helpful for the if new symptoms or newly diagnosis or new treatment someone is invented, the new treatment methods, it is helpful for the early recognition of new condition. If the new symptoms are there, if you return the case series, the others practitioner also they will take the help. Next one is the help to share the clinical experience. Whatever you did, that experience, if you written in the form of case series, the others, other doctors, other practitioner also they will take. That is helpful for the clinical experiences what you did. Next one is the limitations. What are the limitations are there for the case series? The first was no control group for comparisons. Just now I told there is a no placebo and a standard drug, like that. Two groups are not there. Here you cannot tell that the your drug is good or research work is good, like that. There is a no control group or comparison. It is there. High risk of bias, because the chances are there for the mistakes or one-sided result will come. These are the high risk of bias. Next, cannot establish causality. You cannot tell that because of your drug the patient cure, because this is the only few patients are there, and there are chances are there they change their diet or they change their water. There are so many chances are there. By writing the case series, you cannot tell that that is the final drug. This is also limitations are there while writing the case series. Next one is the cannot establish causality. Next is the limited generalizability. Limited generalizability is nothing but, just now I told the you are treated 5 or 10 patients, you return the case series. You cannot tell that the all the remaining throughout the world by same drugs the symptoms cure, or by same tablets or medicines the throughout the world people are cured. This is the cannot tell. You cannot tell. These are the limitations are there. This is called limited generalizability are there. Because you only treated 5 to 10 patients, you cannot claim that the your drug is the final drug for this type of the disease, like that. These are the limited generalizability. This is all about the case series. Hope you understood. If you understood this video, please subscribe channel, like and share to your friends. Thank you.